Good evening. I want to talk to you about triglycerides and cholesterol and how they are intertwined with type 2 diabetes. So don't go anywhere. So I'm going to start out with the background information. Triglycerides and cholesterol are two different types of lipids that circulate in your bloodstream. Triglycerides store unused calories and use them to provide your body with energy, whereas cholesterol is used to build cells and certain hormones. Your heart needs good cholesterol to function properly. However, when you have elevated triglyceride levels or hyperlipidemia, many problems can develop. When you eat, your body converts any calories it doesn't need to use right away into triglycerides to store them for later use. If you eat more calories than you burn on a regular basis, especially from high carbohydrate foods, you're at risk for developing hyperlipidemia or high triglyceride count. A high triglyceride count can be a sign of type 2 diabetes or prediabetes, or a sign of your developing metabolic syndrome. Metabolic syndrome is a condition where high blood pressure, elevated blood sugar, obesity or excess weight gain all develop together. This trifecta of conditions predisposes you to cardiac disease. In my healthcare career in apheresis, I saw probably about a dozen patients that suffer with hyperlipidemia. Now, when you draw a sample of their blood, the serum or the plasma that the cells float in looks like heavy cream. It's disgusting. And I can tell you it's not good for your cardiac arteries. So the critical care team would reach out to our service and ask us to come in and perform a plasma exchange, which involved the patient getting a central access catheter like you would have for dialysis, and you're stuck on the machine dealing with somebody like me for maybe 2 to 4 hours. And if the condition was severe enough, we probably treated that patient 2 or 3 days in a row. Now, that effectively lowered their triglycerides, and when we got done the treatment regimen, their blood serum didn't look like it was heavy cream anymore. But that doesn't address the root cause of the problem. And at this point, you're probably thinking, Dave, when is class over? It's very soon. I tell you all this to encourage you to get your blood pressure, your cholesterol, and your type 2 diabetes and insulin resistance under control. And now the broken record part. I've done all that in 3 simple steps. If you are struggling, there's no better time than the present to get out ahead of it and fix your problem. In less than 12 months, I fixed those issues for me. So the only disclaimer I'm going to give you to this video is it's not a scare tactic. It's meant to educate you into what can go drastically wrong and hopefully give you pause to think, man, I don't ever want to go through that. And you're absolutely right. You do not want to go through that. As always, thank you for listening and have a great evening.